Welcome to the Perrysburg Podcast, episode 92. I'm your host, Perrysburg resident Kim Newlove. The Perrysburg Podcast is a resource for Perrysburg residents. We talk about what's in Perrysburg and why people like to live here. Our website is perrysburgpodcast.com. Kaylee Smith is my guest today. Kaylee works for the Wood County Board of Alcohol, Drug Addiction, and Mental Health Services in Bowling Green, Ohio. By the way, the abbreviation for Alcohol, Drug Addiction, and Mental Health Services Board is the ADAMHS Board. You will hear Kaylee and me say ADAMHS quite a bit during this episode. During our conversation, you'll hear about Kaylee's role with the board's role with mental health and addiction disorders in Wood County, Ohio, resources, upcoming events, volunteer opportunities, and more. But first, before we get started, listener discretion is advised. This episode includes discussions about mental health and substance use disorders. If these subjects are triggering for you, please use your judgment before listening. Your well-being comes first. Again, listener discretion is advised. Without further ado, here's my conversation with Kaylee Smith. Hi, Kaylee. Welcome to the Perrysburg Podcast.
Hi, thank you so much for having me.
It is my pleasure. I have seen the ADAMHS Board come up on the ballot with some levy issues over the years, and I just thought this would be a really good opportunity for me to introduce the ADAMHS Board to my audience so they know who they're voting for and what resources you provide.
We appreciate it so much more than I can say.
Yeah, do you have anything coming up on this May election, May ballot?
We do not. We are typically on the ballot every 4 to 6 years. It's a typical levy that's largely where we pull funding for all of the community behavioral health providers that we fund in the county. And I'm sure you have some questions about that, so I won't talk too in depth about it right now. But that is just our typical operation levy. And I believe you'll see us in another 4 years.
All right. Sounds like a plan. I will vote for you. I will vote for the ADAMHS Board, whatever shows up on the levy.
Thank you so much.
You're welcome. You're welcome. Well, let's do some basics here. Who are you and what do you do for the ADAMHS Board?
So I am Kaylee Smith. I am the manager of marketing communication here, which is still kind of new. I've been here for the last 2 years in that position. Before that, I was the coordinator of strategic initiatives, so doing largely legislative advocacy work in this space. And before that, I had 2 internships, one with our Northwest Ohio region, so all 11 board areas up here. And I did a little bit of marketing in tandem with our National Alliance on Mental Illness, NAMI Wood County affiliate, and the board. And also, I just want to say, while you're asking about me, I want to clarify that ADAMHS stands for Alcohol, Drug Addiction, and Mental Health Services, but we always say ADAMHS because it's quite the mouthful.
It is the mouthful. I remember I didn't even know what it was until I started working at a behavioral health hospital as a pharmacist back in 2016, I think it was, or 2015. And I started hearing the term ADAMHS, and I had gotten the Wood County, what was it? There was this big, thick pamphlet, the Wood County Annual Report, I think, came in the mail, and then I saw ADAMHS in there, and I thought, oh, I wonder what this is. And I looked and I saw the name of somebody that I knew, Randy Rothenbuehler. He was on the board at the time. And I reached out to him and I said, hey, this is what I've been doing. I see that you're part of this. How can I get involved? Or what can I do to help? And he said, come to a meeting. Just come to a meeting. And that's how I got started learning about the ADAMHS Board, a job, and then a volunteer opportunity.
All of our meetings are public. So we love seeing new faces. I love hearing when people have volunteered and their relationship to the board. It's really kind of central to our work to see so many people so enthusiastic about the work that we get to do in the behavioral health space. So I would encourage everyone to have a story similar like yours. Our doors are always open.
Yeah, I appreciate that. And because I went to that meeting, I did get involved. And at the time, they were starting up this Wood County Opiate Task Force, now the Addiction Task Force. It was led at the time by Lori Lewandowski. Now I believe it's led by not Lori Lewandowski because she has moved on and retired. but for a number of years, I was active with it and I provided input as a pharmacist and I did all kinds of volunteer activities. So, anybody listening to this, if you have any interest in mental health issues or addiction disorders and you would like to learn more, then reach out to the ADAMHS board and Kaylee will put you to work.
We always have things to do for sure. And just to kind of piggyback on what you said about the addiction task force, that is still managed here by the ADAMHS board. So that is our statutory responsibility in Ohio Revised Code, to have the addiction task force under our umbrella. So it is now managed by my colleague Amy Coe. She is our director of clinical and prevention programming here at the board. They still meet regularly. Those are all open meetings. You can find information about that coalition at woodcountyprevention.org. They have a full list of events, and they're always open. And we are having a drug take back event coming up, actually. It will be April 26th. I'm not sure if the lovely folks of Perrysburg are hearing this before or after that, but just letting you guys know that the addiction task force that you sat on is still very much active, and you can join us anytime.
Awesome. Good to hear. I love Drug Take Back Day because even though a lot of Wood County law enforcement offices collect expired or unwanted drugs year round, sometimes people need that call to action, that reminder at
Yes.
least twice a year, April and October. Hey, it's time. If you haven't done it lately, let's bring them in. So I'm happy to
Yep.
hear that you're having a Drug Take Back Day event. Good for you.
Yes, and I believe we still use your resource of all of the drug take back locations in the county. So we have all of those listed. We still have your flyer. The one that you made is still up on our website. And but we totally find that when folks have the opportunity and it's fresh in their mind, especially the spring one, it's like, okay, you're spring cleaning your home, spring cleaning your mind. Now let's make sure that you're being safe at home. Really, it's been a great event and we really appreciate watching it grow.
Awesome. Good. I did look at the website this morning and I saw that my drug take back box list is still on the ADAMHS board website. I'm a little proud, I gotta say. But anytime you guys want to revise it, feel free, rebrand it. I'm saying it publicly. Feel free. It's a resource for the community so that people know where those drug take back boxes are and
Mhm.
they can get rid of those unwanted and unused medications and decrease the risk of
Yes.
abuse or harm. I'm a big poison prevention advocate as well. Sometimes when people leave things laying around the house, kids find them or pets. So, yeah, you just got to think ahead, get rid of stuff.
Absolutely.
Well, thank you for introducing yourself and the ADAMHS board. Is there anything else you want to say about in general that the ADAMHS board does for the people of Wood County, including Perrysburg residents?
Yeah, so I always love to highlight our mission statement because it's pulled right out of our section of Ohio Revised Code. So the purpose of an ADAMHS board is to plan, fund, monitor, advocate, and promote all of our community behavioral health care providers here in the county. And we do not offer direct services. So that's a common question that we get here because the name of our board is so ingrained in the behavioral health sphere that we always like to remind folks that we are not the frontline workers. We are the oversight board, but we have 9 fantastic providers here in the county that work with Bowling Green residents, Perrysburg residents, North Baltimore, wherever you are in the county, we have services to help, and we're always a resource. So you can always call and ask if there is anyone in the county that does a particular service that you might need, but it will not be us providing that service to you.
Very good. I'm trying to think of a comparison that people would understand. You're like a dispatcher, kind of. You find out that somebody needs, for example, gambling addiction help, then you would know to throw them over to which agency?
That would be the Zeph Center. They do a lot of our gambling work. We also have some treatment capacity at Unison Health and Harbor for gambling.
That's one of the things people may not think about when they think about addiction disorders. So that's kind of good that we're talking about that. What are some of the common addiction disorders other than alcoholism that people in Wood County face?
I think that we are certainly seeing an increase in vaping, particularly in our youth. So we do a lot of work with our educational service center here to do prevention work, largely in the substance use disorder, or SUD. So if I call it SUD, that's what I mean going forward. So they do some SUD prevention work and they do some suicide prevention work in the schools. So really, there is lots of prevention work happening in the substance use space. And we also have amazing treatment providers for SUD. Those big, kind of the biggest agencies that do SUD work are Ohio Guidestone, which does exclusively have a Perrysburg location. Our Unison Health folks, they have an office here in Bowling Green, but they are absolutely willing to meet folks where they are. And the same goes for Harbor. So really, addiction is really, I think, the lesser discussed between mental health and substance use, but it is a huge part of what we get to do. And we love helping people, whatever behavioral health condition that they might have.
Thank you. I know that there's kind of two, I guess, two different topics that you guys cover. There's the mental health services and the addiction disorder piece. Would you say that they're kind of like separate, but also under the main umbrella of the ADAMHS board?
Yes, largely when you see materials from us, even our website, if you're looking at our service directory, there are some pretty clean lines between what is a mental health service and what is an addiction recovery service. So even things like supports can be different, even if they're offered by the same agency. So we do have a few services offered for co-occurring disorders. So for our folks that might have a mental health diagnosis and need some recovery supports as well. But usually when we're talking to folks, there is kind of one umbrella with two different sections.
Okay. Thank you very much for talking about that. Back to the addiction side. As a pharmacist, of course, that's what I'm always interested in. Ever since I watched Snow White and I saw her eat the poison apple, and then I found out that the antidote was love's true kiss. I've been
Mhm.
fascinated with the whole poison and antidote theme, I guess you could say. I've been fascinated by the poison and antidote theme, and I've been fascinated by the addiction and recovery theme too, because I didn't know about all these things as I was growing up in little Pemberville, Ohio. And as I found out as a pharmacist, there's all kinds of things that people get addicted to, like, opioids,
Mhm.
meth, alcohol, nicotine, gambling, sex. There's all kinds of things. Sugar.
Yes, absolutely. One of the things that Kaylee, as a board representative, is proudest of in kind of the addiction space is 3 years ago. My goodness, I can't believe it's been that long. We received a grant from the state of Ohio and our state department, which is the Ohio Department of Mental Health and Addiction Services. We received a grant from them that was called the State Opiate and Stimulant Response, or SOS grant. And that is, when it was in effect, one of our largest grants for the addiction space. And what we opted to do with it as a board was to implement 3 harm reduction vending machines across the county. So we have one in North Baltimore at Midwest Recovery Center, one at the health department here in Bowling Green, and one at our Harbor Perrysburg location. So upon inception, it was strictly for Narcan because that was kind of the confines of our grant. So they worked just like a regular vending machine, except you had to give us a call first so we could give you a code and you could dispense Narcan 24 hours a day, except at our Harper location because it is our indoor location there in Perrysburg. But recently, in a very exciting change, we have added fentanyl test strips into those machines. And we have also taken away the necessity for a custom code. So now there is one universal code. Anyone can go to the machine and dispense Narcan or fentanyl test strips at any time. So we were, I believe, the second or third county in the state of Ohio to have harm reduction vending machines in that capacity. So it is one of my favorite things to talk about. Again, I already mentioned Amy, who is our addiction task force chair. She really piloted that project and helped bring it to life. And I love talking about it.
That's all right. I think a lot of people who live in Perrysburg have not seen those yet. You said they're in
Mm.
North Baltimore, in Bowling Green, and where was the other one?
Perrysburg.
All right, again is it in Perrysburg?
So it is at our harbor location, which is on Commerce Drive. It is right in the lobby. So if you go in and you don't have an appointment, you're just headed to the vending machine. There is no stigma attached, nothing. You just head right over, put the code in, and all the instructions are right on the machine. If you want to walk over to it and like you maybe you've never seen it before or you haven't sought it out, but while you're there, you say, "Hey, I think I'm going to take some Narcan just to have it on me." All of the instructions are right there on the machine. It's a 4-digit code, and then you leave with your Narcan or your fentanyl test strips. We have a no OD line, which I cannot remember off the top of my head because it does not. Now it is just an informational line. So previously, individuals had to call to receive their code, and that was part of our grant requirements. When we changed that, we kept the line, but now it just gives you some information on how to use Narcan if you need more resources. But now available right on the machine is the code. The number is there as well. If you need help using Narcan, there's some descriptions on where to find that information too.
Okay, thank you. I know you and I are nerding out about this, OD prevention type stuff, but it can be kind of scary for somebody listening to this who thinks, "Oh, it doesn't happen in Perrysburg, not my town." It does. I can say that, as a pharmacist who's been around for 20 plus years, there are people who have issues all over the state of Ohio. So I'm not going to name names or shame anybody, but it does happen here. And just for anybody listening who does not know what harm reduction is, what is harm reduction?
So harm reduction is this is not the dictionary definition. This is as Kaylee, the marketing person, understands it. Harm reduction is the effort to kind of meet people where they are. That's what I always say when we're talking about it. So harm reduction in practice is if you are a bus driver, for example, and you know that you see multiple people having Narcan on you makes it possible for people to, if they are going to use safely and have the opportunity to be resuscitated. So, really, it is a funnel for us to help get people into treatment because we need you to be here in order to get treatment. So when we do harm reduction, things like fentanyl test strips, I know that recently became legal in Ohio to use. So their purpose in harm reduction is if you're taking any medication and over the counter, if you're taking any sort of medication, you can test it for fentanyl to ensure that it does not contain that before you take it. So really, harm reduction is just about keeping people safe and making sure that we can necessitate a pathway to treatment for them.
Thank you for talking about that. I know that harm reduction is something that's not really common in everyday conversation, right? So that's why we're talking about it. It's one of the things that the ADAMHS board advocates for. You just want to make sure that people survive if, God forbid, they should overdose and they're there to live another day and maybe make a choice to try to get into recovery. And it's not easy. And I think a lot of people listening to this may not know that there's that whole relapse and recovery thing. Getting clean, it doesn't always last forever. And, everybody has downfalls. If we go on a diet, sometimes we cheat, right? Or, maybe we try it
Absolutely.
for a year and we revert back to how we were. I think a lot of people understand that with weight gain and weight loss, but it's very similar when it comes to getting clean, getting into a good program, recovering. And sometimes you'll stumble, but maybe you won't stumble as far and you'll be
Mhm.
able to come out of it. So these harm reduction type things are there for people in a very serious time where they just need to make it through another day and hopefully get back on the bandwagon. Anything to add?
So we do have these harm reduction vending machines that now have fentanyl test strips, but we also have been working with our local police and EMS jurisdictions to equip them with Leave It Behind kits. So if anyone is unfamiliar with what a Leave It Behind kit is, it is really a response to an individual that has overdosed. So it's kind of a mobile harm reduction kit. So if there's a scenario where someone has unfortunately overdosed and they have been Narcaned and they are currently doing fine. then the officer can leave the Leave It Behind kit with them. And that kit contains a few more containers of Narcan, which one container of Narcan has two of the actual nasal sprays in them. So two Narcan, and the gloves and like things that you might need if you might relapse, like we were just talking about, or to continue your life safely right after an overdose. We have those Leave It Behind kits. And we also have Nalox boxes, which are, I'm not sure if anyone has seen them, but we have them now in our turnpike rest areas.
I have seen one and I was surprised, pleasantly surprised.
Yes, yes.
You never know when you're going to come upon somebody who needs one.
Yes, right. So we have been piloting that as well. That the Turnpike is a state of Ohio initiative, but we have been doing that here in Wood County as well with our local businesses. So it is just a wall-mounted kit. You do not need a construction degree to put them up. We are an all-woman office and we do have one. They just have the containers of Narcan, some details about how to administer Narcan to someone if they need it, and gloves and things like that. But I do want to really quickly touch on Narcan as an entity and just mention that when you and I are having this conversation about what is Narcan and kind of bringing someone back from an overdose, we always love to remind people that if you are in an instance where you must Narcan someone, it is not harmful and it will not do anything unless it is an opiate overdose. So we don't want folks to be concerned about carrying naloxone because it is not the same injectable version that it once was. You can still get it in that format. But when we talk about Narcan, it is a simple nasal spray that is used in the case of someone having an opiate overdose. And if we obviously would not recommend just taking a Narcan, but if someone did, nothing would happen unless they were facing that opiate overdose.
Thank you for talking about Narcan. As a pharmacist, I kind of nerd out on this stuff and I worry that I'm spending too much time talking about it. But by listening to this, my dear listeners, you may save a life. So keep an eye out for those Narcan kits, follow the directions, and like I said, you might save a life. I was just at the annual meeting of the Ohio Pharmacists Association in Columbus, Ohio over the weekend. It was April 11th through 13th, and I was chatting with a DEA agent, and he was talking about not only is there a problem with, opioid overdoses, people getting illegal fentanyl, but also they're now seeing a problem where there's this veterinary sedative called xylazine mixed in with fentanyl. So even the Narcan may not resuscitate people. So that was a whole new level of scary for me. So just as a reminder, you know, call 911.
Yes.
It's the best thing to do. Call 911, try to resuscitate the person and be a hero. You could save a life.
Yes.
Yeah, there could be some scary stuff in whatever they took. Yeah. But, anyways, let's talk about some of the other substances that people get addicted to. Nicotine, of course, is a big problem, whether it's vaping or cigarettes or whatever people are smoking, cigars. There's all kinds of things with nicotine in them, especially for for the young people. What would you like people to know that the ADAMHS board can offer when it comes to nicotine addiction?
We are specifically in the youth space, and I know we already just said that we're nerding out about the harm reduction, but the kiddo space is really where my soul lives. So, again, I will not pigeonhole us in a specific topic, but really, I think when we are looking at the nicotine, it really is in our youth. So, our Educational Services Center every 4 years does a youth survey. So it is this absolutely massive, brilliant, comprehensive document that basically asked children about their usage, their mental health. It's a huge document. I cannot stress that enough. But we have seen a very noticeable change in our youth not smoking cigarettes and now moving to vapes that still contain nicotine. I believe the youth survey is 21 this year, 21 or 22. So we have data kind of going back to when it was more popular to smoke cigarettes and kind of watching the change post-COVID to moving toward a more vape-focused world. So we do know that our Wood County youth are still engaging with vape, but we are working diligently to try to change that. So our Education Services Center does the prevention work. And we also have the Children's Resource Center, who is just our all encompassing kind of kiddo provider. So when they do prevention work in this space, it really is the harms that can happen to your body, the brain function that you might see changing if you have a nicotine addiction, a vape particularly. And really, I think the schools are starting to take notice as well. So we do, when ESC goes into the schools, they do so much education and they also leave behind resources. So now we have lots of schools with signage that says, this bathroom may have a vape detector or things like that. So we are aware and we are working on it diligently. But really, I would just remind the community to have conversations with their kiddos about what they're doing and what they might be inhaling in this case with nicotine. And really, it is perfectly fine to pose the question, always have the conversation about how we can help them, how we can better be prepared, and hopefully we will see a change in the next youth survey.
It sounds like there's a lot being done to prevent vaping and smoking, right? Is that what I hear you saying based on
Yes.
data? That's the data tells you that that's a big problem area with the youth. Therefore, you're developing prevention activities and education to address that. But what
Yes.
what if somebody's already using and they've found themselves addicted to nicotine and they're a young person, high school age or earlier? How can they get off of the nicotine products? Do you guys have counseling services you refer them to, or is that at the CRC?
Yes. So our CRC, if you are below the age of 24, that is where we would send you for that treatment piece. So ESC is really kind of a support. There are prevention folks, but if you're looking for treatment, CRC is typically where we would send folks. So they have as we mentioned at the top of the episode, they are one of our co-occurring disorder providers. So if there is a mental health aspect, a SUD aspect, or both, then they can help treat our youth. We also have some services for youth available at Ohio Guidestone and Unison. We love client choice. That's why we contract with the agencies that we do. So largely, our recommendation would typically be CRC here in Bowling Green, but we have so many options for anything that folks might need especially in that like counseling group space.
It sounds like, again, going back to my term, you guys being a dispatcher, if a parent comes to you and says, "Hey, my senior in high school is addicted to vaping. I had no idea. And now I need to get them some help." They can call you and you will recommend somebody that maybe two or three that they can look into and find out if geographically that's where they want to go or payment wise that's where they want to go, right?
Yes, so that's an excellent point. Something to also make note of. So one of the board's statutory responsibilities is that funding piece. So we are a resource if folks maybe they cannot be on Medicare or Medicaid and they do not have private insurance. We do have mechanisms to really help meet folks where they are. So there is a sliding fee scale at our agencies. So kind of a pay what you can, and the board will help in those gap areas. And we have hardship forms, which is kind of how we streamline that process. So you work with your agency to say, this is my financial situation. I'm ineligible for other insurance entities. And then we get a form and we say, you need treatment? Absolutely. So at the top of the episode, when we talked about the levy, that's also kind of where that funding is pulled in, is really meeting folks where they are. And that is across the 9 of our providers. So even if you come to us and you say, I was at this agency, now I'd like to move to this agency in the continuum of care, the same applies. So you'd have to do a secondary hardship form, but we will not turn away folks. Our Wood County clients are our clients. So client choice, the payer source, we really are wherever you need us to be, we will be there.
And thank you for what you do.
I love that aspect of this oversight board, but I also cannot say enough good things about the people that are in the agencies doing the work. So I am honored and having so much fun to be talking to you from the board perspective, but I really want to save some space to say thank you to all of our crisis counselors, social workers, janitors, all of the people that run our agencies that really they are boots on the ground helping folks right where they are. And we just get the joy of being the oversight and getting the success stories and helping folks live their best lives.
I love it when people collaborate. And I know that you also collaborate with first responders too. Would you like to talk about that?
Yes. So we, with our local NAMI affiliate, the National Alliance on Mental Illness, one of their largest programs is called the CIT program, which stands for Crisis Intervention Team. And that initially started as just law enforcement, but now has several iterations across dispatchers and first responders and nurses. But that program is essentially working with our law enforcement to ensure that they are prepared to help folks in a behavioral health crisis. So it talks about different diagnoses, different symptoms, how you can delineate between what is a physical health symptom and what might be a mental health symptom because they can look similar. And it really just fosters empathy and compassion and helps officers, nurses, dispatchers, etc., kind of know how to help folks in a way that is helpful and safe for both parties. And we do some work with our jails. So we do have injectables in the jail, or medicated assisted treatment is what we would call it here, MAT, MAT. And basically, those are our incarcerated folks that need medication to kind of help on their behavioral health journey. We work with Unison Health to go into the jails and administer those safely. My gosh, we do so many things with law enforcement. I love working with our law enforcement.
There's a lot of collaboration in the, mental health and addiction,
Yes.
space in Wood County. Even the prevention specialists that are in the school. I think maybe some parents in Perrysburg schools may not know about the prevention specialist at Perrysburg High School. I think we only have one, right?
I believe that's accurate. Yes.
Okay, yeah, and some, like I said, so this is a good opportunity for you to talk about that as well. Not that the first responders are not important. Sorry, I kind of cut you off there, but
No,
if you don't mind, let's transition over to the prevention specialists. Is that something that the Wood County ADAMHS Board has to do with, or is that more NAMI? Let's talk about prevention specialists at the schools.
our prevention specialists are actually an educational services center initiative. So we do work in tandem with them for that. So we don't fund the entirety of the ESC programming, but if it is a prevention space, then that's typically where you can find us collaborating. So the prevention specialists that go into the schools, they are really integrated into kind of the school society. They get to know the kids, they get to know the teachers, and their responsibility is really to understand the needs of each school district and how we can better suit those needs. So the Educational Services Center has a menu of services. So unlike a treatment agency here in our community, they don't have like we will offer these 6 services at the same time because we have group and therapy, etc. The ESC instead will go to a school and say, what do you need? Do you need sexual abuse prevention? Do you need substance use prevention? Really, what are the needs that you have for us? And then it was really up to the school. So the prevention specialist really works to find the needs and help meet those needs. So they facilitate programming, they meet with the children. I believe a few of them have therapy dogs, which I also love to talk about.
I
So
love therapy dogs.
yes, we're getting more in the schools. In tandem with ESC and us, our NAMI affiliate has a program in the schools that is very cool because it is peer run. So they do some prevention work with the kiddos more on the mental health side than the addiction side. but it is typically facilitated by either the parent, loved one, or someone that has lived in a house with a kiddo that has a mental health diagnosis or some mental health needs. So really the kids are able to get a firsthand experience with how to advocate for themselves, how to tell their story. It's very cool. I'm very proud of our prevention specialists. I love seeing them. So the schools are a huge kind of target area for us.
I didn't know that there were even prevention specialists until I started volunteering with the Wood County, at the time, Opiate Task Force, now Addiction Task Force. And they would show up to the meetings sometimes and they would talk about what they did in the schools. And it's, prevention education and finding out what the needs are and serving them. I'm sure it's, like you said, it's probably a delicate topic that the school system needs to talk about what they're going to offer, but they're definitely in Perrysburg schools. And since this is the Perrysburg podcast, we are definitely going to, talk about that. I was really impressed with their level of education, and they knew more than I did, to be honest. And I appreciated that. I learned from them.
Mhm.
Now, on the mental health part of the ADAMHS board, I know that you do a lot with NAMI. So do you want to talk a little bit about what NAMI does and what the ADAMHS board does when it comes to mental health issues? You have the floor.
Yeah, absolutely. So, NAMI is part of our recovery support network. So recovery in this instance is mental health and a little bit of substance abuse as well. So largely mental health because they are our mental illness recovery supports. But they offer support groups. So there are several support groups that NAMI offers that are kind of specialized. So they have what's called NAMI core curriculum. They are a statewide organization. They're a national organization with a statewide organization with our local Wood County affiliate. So NAMI National creates programming that NAMI Wood County then offers. So similar to the ESC and that menu of services, they kind of talk to the community. They monitor any phone calls that they get and see what programs people really need and support groups. So they have, for example, a peer-to-peer, which is facilitated by someone living with a mental health condition. They have a family-to-family, which works similarly with loved ones. They have a caregiver support group. I would encourage everyone to go to NAMI's website, which you can find via our website in the episode about. Um, but they have plethora of services that really focus on being an ongoing support system. So even if you have had a diagnosis for a decade and you just need some support, then you can go to a NAMI support group. You can go to a NAMI support group if you just got diagnosed. If you're not sure of your diagnosis, they will welcome you with open arms. And they are a lovely partner to work with. They also do some events, which is where you really see us collaborate. So we don't really collaborate on the NAMI curriculum because that is evidence-based, pre-created by the national organization. But their local events here is where you'll see us collaborate. So they have a mental health conference series coming up in May. I believe it is the 29th of May, and that is where they basically put on a symposium of different panels to talk about a specific mental health topic. So this year it is helping the older population. So talking about how older populations kind of encounter and navigate the resources for mental health here in the county. They also do really fun events like their Afterburn, which will be in the fall. And that's kind of a trunk or treat, chili cook-off, support network event. So they are one of the key players in our mental health supports. And of course, we have treatment providers as well in that space.
And just for anybody who doesn't know what NAMI stands for, maybe we should talk about that. What does NAMI stand for?
It is the National Alliance on Mental Illness. So it is a grassroots organization. They started as there were some NAMI mommies that had some kiddos with some mental health challenges. And they decided that they were going to create some support groups. And then it all just fell into place. They became the statewide organization, and then we started replicating them across the nation. And Wood County is very fortunate to have its own county NAMI. Some of them are kind of cross county based on our smaller counties here in Ohio, but we are very fortunate to have a very active and singular county NAMI.
Thank you for talking about that. And just to go a step further, what are some of the mental health conditions that people should associate with NAMI? A lot of suicide prevention, I know. What else would you add to that?
So I would, of course, say that any diagnoses, NAMI will welcome you with open arms. Lots of suicide prevention going on. As you mentioned, they are a huge player in our suicide prevention coalition, which operates just like the addiction task force, except it's in the vein of suicide prevention. But we also have, anxiety, depression, post-traumatic stress disorder, PTSD, obsessive compulsive disorder. There's some schizophrenia. I don't know. I'm not sure if that answers your question.
Thank you for talking about that list. There just might be some mental health diagnoses that people in Perrysburg may not associate with mental illness or mental health. And I appreciate you going over some that are on your list.
Absolutely. And I do want to mention a separate agency, but in that recovery supports, just so the fine folks of Perrysburg know that it is open to them as well. Our harbor has the Connection Center, which is here in Bowling Green, and it is open to any client at any of our behavioral health agencies. So even if you are an Ohio Guidestone client, you can absolutely come to the Connection Center, and it is our clubhouse. So it isn't a traditional support group with curriculum kind of area, but it is always running new groups, and it is run by the individuals that attend. So you can walk in and you can say, I didn't see a chess group and I would love to have a chess group for my friends and I. And they will work with you to create kind of a club, and they have a monthly calendar. They go out, they watch movies. NAMI works in tandem with them to do their night out programming. They will have paint nights, they will have outings and things. So if you're just kind of looking for kind of ongoing support in more of an informal fashion, the Connection Center is open 7 days a week. So I would highly encourage folks to look into it if they're interested.
Thank you very much. Do you happen to have a website for that, or is that one of the resources that is listed on the ADAMHS board in the resource section?
We have a service directory on our website, and it is filterable through any service that you might need. But if you go to specifically for the Connection Center, if you go to the mental health tab at the very base of the page, there is a section called mental health supports, and that's where you'll find the information about NAMI. And I believe Harbor is listed as a treatment provider because they are, but in their kind of second paragraph, I believe, is all of the information about the Connection Center. The Connection Center also has transportation. So if that is a barrier for my Perrysburg folks, we absolutely have the capacity to get you to the Connection Center.
Thank you for talking about that. I think as much as this episode is a resource, I want to make sure that people can, take this information and put it to good use after they have listened. Any other resources you want to talk about before I start asking about upcoming events and ways to volunteer and things like that?
I want to absolutely be sure to talk about our crisis care. That's kind of the thing that we leave folks with, because I really want the community to know that we're absolutely here if you need ongoing care, if you need to start care. But if right now in this second you are in a behavioral health crisis, we can absolutely help you. So our fine folks at Unison Health have a multi-pronged approach. So they have the crisis line, which is 419-502-HOPE or 419-502-4673. That number is 24/7, 365. You can call anytime, and they will send someone out to wherever you are, wherever you need them to be. They also will work with law enforcement. So, say you call 911 instead, we also have the capacity to send our crisis care workers out there as well. So, they'll be with you as well. But they also have the crisis stabilization unit here in Bowling Green, which is a voluntary unit. So if you are in a behavioral health crisis and you happen to be in town, or you want to admit yourself, we do have that space for individuals. And it is just when we say crisis stabilization, we mean that you can come in, you may have a room for up to 2 weeks. We will work with you with treatment. We have had BGSU students that say, I just have to leave to take this final. Can I leave and come back? And the fantastic folks at Unison have accommodated their needs, any dietary restrictions or anything. So it really is like a safe space for stabilization. And adjacent to that, in that same building, it is on Poe Road here in Bowling Green. We have a brand new mental health urgent care. So if you are familiar with how urgent care works in the physical health sense, it is the same way, but just for your mental health. So if you wouldn't consider yourself quite crisis, but you are kind of having like an overload of symptoms or something, if you have an established diagnosis, then our mental health urgent care folks can kind of help stabilize you in a shorter time frame than the 2 weeks of our crisis stabilization unit.
I have never heard of that before, a mental health urgent care, and that's in Bowling Green?
Yes, it is in the same building that our crisis stabilization unit is in. So kind of half the building and half the building.
Very cool. I think that people don't know when a crisis is going to hit, so it's good to know about these things ahead of time, so it can be part of a plan or part of a list on a fridge. If you know you have a diagnosis already, then you could include that and as part of a crisis plan, right?
Yep.
I'm a big advocate for poisoning prevention, but sometimes poisonings happen. So that's why we have the poison helpline. And it sounds like in a similar way, I'm trying to kind of relate the two. It's good. You don't want something bad to happen, right? But you need to have a plan for when it does. And it
Yes.
sounds like this mental health urgent care is such a thing.
Yes, absolutely. And we will have some materials going out about it. There is a button on our website in the same service directory. There is a crisis service section, but there is a button that will take you right to Unison Health website so you can learn all about the crisis stabilization unit and the new mental health urgent care.
Very good. Thank you for talking about that. Any other resources you'd like to talk about before we switch and we start talking about upcoming events?
Not in specific, but I would just recommend looking at our website. If you're in the service directory, please explore it.
All right. Thank you very much. There is a lot of great information on the website. It's wcadamh.org, and I will put a link to that in the show notes on perrysburgpodcast.com. Now, for upcoming events, tell me what's coming up for you.
If you are unfamiliar, May is Mental Health Awareness Month. So it is one of the kind of biggest months where we see our providers doing events, we do events. But for us here at the board in specific, we are hosting our second annual behavioral health art show. So it will be here in Bowling Green from 11 to 3 o'clock at the Wood County Museum. And essentially, it is an art show that we do in tandem with the museum that really places focus on hopefulness and recovery and what life might look like through the lens of individuals with behavioral health conditions. And I don't think I've said this before in the show, but when we say behavioral health, that is the umbrella term for mental health and substance use. So all encompassing. But we have artists from all over the county. So here in Bowling Green, Weston, Perrysburg, we put out just kind of a shout into the Facebook void. And we say, if you are an artist in any capacity, if you are a painter, if you are a musician, if you are a poet, and you would like to share your artwork with us, that relates to your behavioral health journey, we would love to have it. And we get such exceptional pieces and such brilliant descriptions. And I always like to say that this is the whole human experience on display because we will get this is artwork from when I first found out that I had post-traumatic stress disorder, all the way to this is what my life looks like in just sheer hopefulness. So we have curated exhibits that kind of walk you through that. What is the early onset of my symptoms and where am I now? And we have been so fortunate to have been welcomed by the Wood County community. Last year, I believe we had 30 pieces, and this year we have about 60. So we doubled in piece size, and it is just the most incredible experience. I would highly encourage anybody to come out and spend some time with us and really see what the world looks like from the lens of folks that might have different challenges than you or might have very similar challenges to you. I could do the entire 45-minute episode on how much we love this event. But really, we're hoping that eventually we will have a bigger space. So we love working with the museum and we love doing the gallery experience, but hopefully it will eventually become a transient show. So if anybody in Perrysburg, or how far can I get in the county? Northwood or North Baltimore. If they have some transportation barriers, we'd like this show to be bigger every single year.
Thank you for talking about that. This event is on Friday, May 9th, right?
Yes, ma'am.
All right. I see it on the website, on the Wood County ADAMHS Board website, and it says it's from 11 a to 3 p. It's just one day. Is that right?
Yes. So we are hoping to someday move to kind of an installation for a week or Mental Health Awareness Month. But we are also very respectful of our client artwork. So we have some needs that folks, require them back for, or they have other shows. So for this year, it is just a single day, but we are very hopeful in the future that we will have the space and accommodations to make it an installation for a little bit longer.
Way Public Library up here in Perrysburg, our local library, sometimes has artwork in the basement. So around Veterans Day last year, they ended up having veterans artwork. Either things they had taken photos of, or, hand-drawn images, or mixed media, whatever they wanted, and they advertised it in the newspaper. And as you were telling me about this art show for the ADAMHS board, I was just thinking that you could have one day where it travels to the Wood County Museum, which it is this year, and then maybe it could head over to Way Public Library or some of the other libraries. Just throwing out an idea, because not that I don't want to travel to BG, Kaylee, but when it's in your own backyard, it's kind of nice.
Absolutely. And first of all, thank you so much because I love when folks have ideas. I am very much like, you dream it, I'll build it kind of a person. So I appreciate the feedback. But I do would love to see more participation in other areas of the county, just even in artwork itself, the artwork that we give folks. So I do feel if it was transient, and I am not at all complaining because we doubled and our first year was brilliant. The second year is shaping up to be brilliant. But I would love to give more folks the opportunity to have their artwork be shown and attend the event.
Very good. And what's the name of this event? Does it have a special name to, honor the people that have created this art?
So we typically call it, this year we will as well, the Resiliency Through Art show. So really, the while we do have pieces that might touch on some darker subjects, the whole theme of the event is about visibility and accessibility and hopefulness. And while I have 1 second, I do just want to say, if any of my Perrysburg artists are listening, or if any of my artists are listening, just how thankful I am for them being so open and vulnerable with a topic that can be very nuanced and very scary to talk about on a public platform. How much, on behalf of myself and the board, it means the whole world to us that they let us in and they let us put their art on a wall, and you let people come in and you let them see you in your absolute worst and your absolute best. It is the most heartwarming thing that I get to do in this job. And I'm just so incredibly thankful for this event and these folks.
Being vulnerable can be kind of an uncomfortable feeling, opening up this thing that you've drawn to represent a feeling that you've had. I get it. And thank you for putting it that way because you're right. These people are being very brave.
Mhm.
Yeah. All right. Any other events that you would like to talk about before we get to volunteer activities?
I do not, but I do have two events to talk about that have to do with volunteer activities. So if there's something that you want to ask specifically before I jump into those, by all means.
Nope, I just wanted to give you an opportunity to promote yourself. Volunteer activities are where my heart is. I very much enjoy volunteering, so I always like to give people an opportunity. If there's something that my audience can do to help you, let's hear about it.
We talked about the Addiction Task Force. Please join if you're at all interested. But our Suicide Prevention Coalition is, again, just like the Addiction Task Force, but in the vein of suicide prevention. And it is operating with five subcommittees, I believe. So we have age group subcommittees from children and adolescents all the way to adults, and we meet as a coalition, which I would highly recommend you joining if you have any interest in suicide prevention. But our two largest events of the year are coming up in June. We have a family fun weekend here in Bowling Green, and the Friday, June 27th at 9 p.m. for our adult folks. It is family friendly, but from our adult subcommittee, there is the Suicide Prevention Glow Walk. So it is kind of a memorial walk, and it happens at the Wood County Fairgrounds right here on the track. But we dress in our best glow stuff. We have milkshakes provided by our dear friends at Frosty Fair. They are in suicide prevention colors. Last year we did purple, so I think they're going to be purple again this year. But we do like free giveaways and raffles. And the next day, Saturday, which will be June 28th, from 11 in the morning to 2 p.m. at the fairgrounds again. There is the Youth Resiliency Jubilee, which is out of our kids subcommittee, and it is kind of rooted in adventure play. So, really giving families the capacity to have a safe space to talk about suicide prevention age appropriately and play and learn about their feelings. There's food, there's games, there's music. We also bring our mascot. Her name is Stella, the stigma busting cow. So we always have miniature cows to give out. And those, I would highly encourage you to come to either or both events. There's information on our website about that too. But if you're interested in volunteering, either to just sit on the coalition or to be a volunteer for either of those events, there is information on woodcountysuicideprevention.org for all of that.
Very good. Thank you for talking about those suicide prevention activities. By any chance, do they talk about QPR instead of CPR, QPR?
Yes, so we have two facilitators of QPR training, which is question, persuade, refer training. Our NAMI affiliate does some of that work, and so does our Educational Services Center.
QPR is important stuff instead of CPR, saving your victim's life there with some CPR, cardiopulmonary resuscitation. The question, persuade, response can save a life when somebody's considering suicide. So
Mhm.
QPR, if you haven't heard of it, look it up or come over to the Suicide Prevention Glow Walk or the Youth Resilience Jubilee. You can learn about it there, right?
Absolutely. Yep, all of our agencies will be there. Bring your questions, bring your kiddos, come hungry.
Yeah, well, if there's a glow walk, I mean, kids love glow sticks. I don't know if anybody's going to let their kids stay up late for that, but if you're in BG and you want to let your kids stay up late and play with glow sticks, sounds like a good event.
Yes, it is a blast. This year we'll have t-shirts and milkshakes. It's a bit difficult to plan an outdoor event in the spring and summer in Bowling Green, in Wood County in general, because you either get the sun doesn't set until 10 p.m. or the maybe it will rain and be kind of icky for an outside event. So the glow walk starts at 9 p.m. and the Resiliency Jubilee starts at 11 a.m.
Thanks for the details. I think it's important to raise awareness about suicide and suicide prevention, so thank you for making an effort to create awareness.
Absolutely. It is one of our key focuses here at the board.
Very good. We covered so much. We talked about who you are and what you do and resources, things you're promoting, crisis care, which I didn't even know was a thing. So I appreciate you talking about that. Volunteer opportunities. I bet there's one thing that we haven't talked about yet. How about openings at the board? Are there any openings for the Wood County ADAMHS Board right now?
Yes, so there is not employment opportunities for board staff, but if you have any interest in being a board member, we do have 3 vacancies right now. We have 2 ways for folks to apply to be on our board. The first is through the Wood County Board of Commissioners, and I should note that these are both available on our website in several places. So our board membership and under employment opportunities on our website. This information is there, but you can do the Wood County Commissioner's route, or you can apply on the Ohio Department of Mental Health and Addiction Services website to be on our board. So I believe we have 2 county commissioner vacancies and 1 from Ohio Moss right now, as of 4/16/2025. We have 3 vacancies. And as we talked about at the top of the episode, our Ohio Revised Code statute that kind of governs our board tells us that we need some specific folks to join our board. So if you are a clinician that offers either mental health or addiction services or both, you can apply to be on our board. If you are an individual that is currently receiving mental health or addiction services, you can apply to be on our board. Or if you are a loved one or a parent or a peer of individuals living with mental health or substance use disorder, you can apply to be on our board. So consumer, client, or clinician is the quickest encompassment of the board makeup.
Good info. And I've got to say, these are the volunteer opportunities, right? These are not the paid board opportunities. So you'd be a volunteer on the 12-member board for the Wood County ADAMHS Board, correct?
Yes, yes. So all of our board members choose serve without compensation, and they have the lived experience. So our board members get to come in and they get to hear about all of the brilliant work that our providers do, and they get to hear from the staff, and then they get to help drive the decision-making process for what behavioral health in Wood County looks like.
It's important work, and I hope you get some excellent candidates for all of those vacancies.
Thank you so much. Thank you for asking.
Oh, you're welcome. Yeah, I'm just trying to get you some good qualified people because I know the important work that you do needs to carry on here in 2025.
Speaking of, if I think we're kind of closing, that I wanted to make sure that I touched on, kind of in conclusion, while we talk about our board members. At the top of the episode, we talked about our levy and that we were just on the ballot. You just saw us on the ballot in November. So I wanted to be sure to just say thank you to our community for passing our levy. And we really appreciate everyone seeing and talking about the work that our providers do. Without the support of this fantastic community, then our work does not get done and we do not get to help as many people as we help. So, since we are sincerely thankful for the levy passing, and particularly it did beautifully in Perrysburg. So, while I'm on the Perrysburg podcast, I'd like to say thank you to Perrysburg in specific. And we just are so appreciative of the support that the Perrysburg community continues to show us.
Well, as a Perrysburg voter, you're welcome. I appreciate you being on the podcast today to talk about what the Wood County ADAMHS Board does and who you collaborate with, upcoming events, volunteers, stuff. This has been a great conversation. Anything else as we truly close this out?
I don't think so. Thank you for having me. This was so fun. If you ever on the record or off the record want to talk harm reduction or about Stella the stigma busting cow, our telephone lines are always on. And just thank you for having me on. Thank you to Perrysburg for listening to me geek out about all of the things that the board does. And it was just fantastic. So thank you.
My pleasure. Thanks for being on the Perrysburg podcast. You take care, Kaylee.
You too.
Thanks again to Kaylee Smith for being my guest today on the Perrysburg podcast, episode 92. Thank you also to the ADAMHS Board for all you do. Thank you to all the providers and first responders and prevention specialists, all the volunteers, everybody who helps with mental health services and addiction disorders in Wood County, Ohio. I appreciate all you do. A lot of you that may be listening that I've worked with through the Opiate Task Force, now the Addiction Task Force, know that I really care sincerely about all you do. So thank you again to everybody in the mental health and addiction disorder space here in Wood County. I hope our conversation today, Kaylee and I, gave you a better idea about what the Wood County ADAMHS Board does, resources available to Wood County residents, including us up here in Perrysburg, upcoming events, volunteer activities, how much the ADAMHS Board appreciates your vote on tax levies, and more. We covered a lot during this interview. Go ahead and check out the show notes on perrysburgpodcast.com for links. There are a lot of links today. You will find a link to the Wood County ADAMHS Board's website, a link to the resources page on the ADAMHS Board's website, the Drug Take Back Day website, and more. And remember, the next Drug Take Back Day is Saturday, April 26th, 2025. As I publish this on April 25th, 2025, that's tomorrow. So go ahead and get your unwanted medications out of the house, take them to a local collection box. There is a website in the show notes that will help you find your closest collection box. And if you live in the Bowling Green area, you can drop off your unwanted medications at 100 South Church Street, Bowling Green. That's the Wooster Green Park. That's the one that Kaylee mentioned at the beginning of the episode. Information about that is on the Wood County ADAMHS Board's website. They'll be out there from 10 a to 2 p on Saturday, April 26th, 2025. Again, that's the Drug Take Back Day event in Bowling Green. I live in Perrysburg, and believe it or not, I typically drop off my unwanted medications at the Maumee Police Department in Maumee, Ohio, of course, because they accept more than just solid tablets. Our police departments locally only accept solid tablets except for a few exceptions. So if you want to go to Maumee Police Department with your EpiPens, any injectables that you have, they can take them there. And they usually have some University of Toledo College of Pharmacy students helping as well. If you know someone who might like to learn more about the Wood County ADAMHS Board, please share this episode with them. And subscribe to or follow the Perrysburg podcast on your favorite podcast player and YouTube to get each new episode right when it comes out. Thank you very much for listening today. I'll talk to you next week.